Hello, my name is Narissa Rowe, and I am currently a student at Independence University. I am planning to get my degree in Associates of Occupational Studies, but gravitate towards the field of medical assisting. I currently work in a neurology clinic where I have worked for over 15 years. Now, during that time, I was working at a private practice. So when I started, um, there was no need for a certified medical assistant. Um, so during that time, I was very limited in what I could do in the office. And as a medical office assistant in the state of North Carolina, you are somewhat limited on what you can do in the medical field. Um, in medical assisting, you're pretty much all throughout the office. You obtain knowledge that you can learn throughout the entire office from check-in all the way to check-out. We learn insurance, we learn prior authorizations of medications, injections, but in the state of North Carolina, you have to be a certified medical assistant in order to do more hands-on clinic work. In our state, we have two actual groups that we can get our certification through, which is the AAMA, which is the American Association of Medical Assistants, and then NHA, which is the National Healthcare Association. The hospital that I currently work for now, we have just transitioned over from a private practice now to a medical hospital setting, does take both. My goal is in the 15 years that I've worked in neurology, I simply know neurology. But again, I was limited because I was not certified. When we, in neurology, we don't do many injections. We don't do many infusions. We usually send those straight on to the hospitals where nurses handle that. But as we started to flourish more in neurology, we have now started taking on new roles. So we've now started taking on roles like Botox injections. We're now still taking on the new CGRP medications. I don't know if you've heard of those. Those are the medications that are now the preventative medications for people who have migraine headaches. Some of y'all may have seen the commercials for Aimovig and Emgality. They're the 1-month injections that are used to treat migraine headaches. We are now doing those in our office. And in the medical, if I was just a medical assistant or a medical office assistant, I would not be able to do those because I would need to be certified to work under a physician or a nurse practitioner or a physician's assistant that would be able to sign off on what I did. And so now that has come into play in my practice, I now know how vital it is to become certified. But I also know how vital it is to get a full around establishment of what the field of medical assistant is. Because there may be a chance that I want to go and help in pediatrics or neurosurgery or other specialties, and I want to be able to be fully grounded and rounded in all specialties and not just neurology. I have learned that with this certification, it takes you higher. You're more hands-on. You're not limited. When you're certified, it seems like right now, I am a certified medical assistant. I went through NHA and I tested out. And I am a certified clinical medical assistant. And with being that, I am now able to give vaccinations for COVID-19. And my goal as a medical assistant is to help others and be the advocate for others that cannot be an advocate for themselves. to have empathy for those who are struggling, and to help them, those that don't understand the medical terminology, that doesn't understand what's going on with them right now, to explain it in a way that's more understandable to them. I want to be relatable to my patients, and I want my patients to be treated as if it was my mother, as if it was my father, a family member. So when it comes to medical assisting, it's a rewarding job. It's rewarding for me because I am able to see others every day, and I'm able to help them the best way that I can with my medical assisting degree. But most importantly, with the pandemic that we have going on right now with COVID-19, I want to be able to help those that don't understand about this pandemic and how vital it is to have the vaccination. I have run across many African Americans who have told me they don't want to take it because they're scared of what they've seen on TV. And I explained to them, I have taken the vaccination. I have taken both doses. I am fine. And it is so imperative for African Americans and Hispanics to learn that this pandemic is something that we should be worried about, yes, but there is something out there that can help. I try to gravitate towards those individuals, not out of any, condescending way. I gravitate towards them because I have tried to get them to be safe as others are that are safe. We do understand that there are some boundaries, language barriers, and sometimes lack of education that makes it hard for them to fully understand the need for health care. And so my goal is, and has been, is to try to work with these people, work with these individuals, and let them know, I'm here to help. I'm here to educate as much as I can. Can I give you medical treatment? Can I give you a medical diagnosis? Absolutely not. That's not in my scope of practice. I have learned in medical assisting, there is boundaries. And those boundaries are followed by an MD, a nurse practitioner, and a PA telling the medical assistant the information and relaying it to the patient. I have gotten my office to work closely together with public housing authorities in our local city here in North Carolina to try to get a ban to take those that are less fortunate and underprivileged to our local hospital to get to do the vaccination clinic. I do the vaccination clinic at least twice a week. I do that outside of my job where I work at in neurology. And I do that, and it's rewarding. It's just hard to understand and see these elderly people and how they're coming out here for these vaccinations, and when they get it, they're so happy and they're so appreciative. And we're in the middle of a pandemic right now, and I'm from the South, so it's hard for a person when they're so appreciative, they're wanting to hug you and you can't hug them. You have to give them the fist and say, you did a great job, when all they want to do is hug you for helping them in their health. It sounds cliche, I'm sure, but my heart means that I want to help. My heart wants to help people and to educate them as much as I can in the scope of practice that I can, and be an advocate for those who may not understand. Down the road, I definitely would want to possibly pursue higher in the medical field. I would love to be a nurse. I would love healthcare management. all of that varies, you know. Um, and it's what's not to say that it can't happen. But right now, I just want to be a medical assistant and continue to do what I do so well, and or what I do, I think I do well. I try to do the best that I can, and that is to help others help themselves. I thank you for this opportunity to let you know how I want and how I plan to be a medical assistant, and the reason why I want to be a medical assistant and pursue this field. And thank you very much for the opportunity to elaborate why I want to be a medical assistant. Thank you, and God bless you.